my name is Jessica Story. As you all know, obesity is a rising cause in America today. You see, a recent study conducted by the National Health Service shows that 54% of doctors believe they should be able to deny treatment to an obese patient. Why do so many doctors stand firm in this decision, you ask? Because of the increased risk factors that occur when operating on obese patients. Operating on an obese patient makes the risk factors of the operation increase dramatically. It has been shown that operating on obese patients means that they could have spent an extra 2 hours on the operating table. But the risk factors not only increase within the patient, but with the doctors as well. Doctors should be able to deny treatment to obese patients, not only because of the risk factors increasing within the patient, but with the doctors as well. The Docotrs company has seen an increasing amount of lawsuits because of obese patients. Loss analysis on claims have shown and identified 287 patients ranging from ages 4 to 82, resulting in 84 deaths. Statistics here say that 60% of doctors over the age of 55 say they've been sued for malpractice when operating on an obese patient at least once in their careers. Doctors, as well as patients, are put at such an increased risk in the situation, which is why doctors should have the ability to deny treatment to obese patients if they feel the need to. Although it seems quite discriminatory against obese patients, there's obesity centers designed specifically for obese patients. These centers provide good assistance to these patients and can help with weight loss or can help them get another treatment that they may need for their operation. Centers such as the Centers for Disease Control and Prevention, or CDC for short, their Division of Nutrition, Physical Activity, and Obese Centers are working to provide assistance to these patients. These centers are helping to provide assistance with obesity patients and working throughout America to reduce obesity levels. These centers can provide the assistance that these patients need without putting such a risk factor on the patients as well as the doctors. Doctors should have the right to refuse treatment to these patients if they feel the need for it, because it's only for the better. Obese patients have such a high risk factor when being operated on that it could result in death and or a lawsuit to the doctor, as shown as the Docotrs company's website. Why should you want to be put at such a high risk when there are other options, like the Center for Disease Control and Prevention's divisions and foundation? There will be a major decrease in lawsuits as well as deaths occurring with obese patients. You can help prevent these risks and dangers to obese patients by supporting the organizations like the Center for Disease Control and Prevention, and this work would mean the difference between life or death in some obese patients. You can make a difference when supporting these organizations and foundations and spreading the word that doctors should have the right to refuse treatment to obese patients. There are better options for obese patients, and with everyone's help, people will soon realize the dangerous risk factors put on the patients and the doctors. Doctors should have the ability to deny treatment to obese patients because it's only for the better. Thank you.